India is the scene of a public health calamity. The total collapse of the health infrastructure and the retreat of the state.
It's a nightmare after nightmare at hospitals all across the country.
There have been some extremely disturbing visuals, crematoriums overflowing. They're just lighting these makeshift fires and burning them en masse.
संक्रमण इतनी तेजी से बढ़ रहा है कि अस्पतालों में जगह नहीं मिल पा रही है.
Certain sections of the media that were hitherto subservient to the ruling regime are being forced to ask questions. It's a very thin silver lining in the dark clouds that have otherwise enveloped the media in India.
From the early days of the pandemic, Prime Minister Narendra Modi's BJP government has been determined to control the coverage of the story. In March of 2020, it asked India's Supreme Court to stop media organizations from publishing any COVID-19 related news without first getting clearance from the government. The court refused to do that. That was 13 months ago, more than 16 million cases ago. And those official numbers are not to be mistaken for India's reality.
All governments tend to fudge numbers to make things look better than they are. Let's consider the case of Bhopal, the capital of the state ruled by BJP. Last Tuesday, the state reported 5 COVID deaths, and yet 85 cremations were performed following COVID protocols. The numbers being reported by the government are vastly exceeded by the funerals taking place across India.
Digital media platform hai kuch.
Some digital media platforms are working to dig out the actual figures, but their reach is limited. It's also risky work. You have to stand outside a cemetery, count and cross-check. COVID bodies come covered with plastic and the staff carrying them wear PPE. So this is how we're getting the news. And where is the government's focus? It is to somehow mask these figures so that their failure and inefficiency stays hidden.
The COVID numbers coming out of India have been questioned by scientists who say the relative lack of testing there makes those statistics inherently flawed. The official number of cases now exceeds 16 million, but the death toll, 180,000 plus, is somehow less than half that of Brazil, which has fewer cases. It just doesn't add up. An independent study conducted in mid-2020 to detect antibodies in the population concluded that for every official COVID case logged, around 30 cases have gone unrecorded. Do the math. That would take India's official caseload to about 480 million. That information is out there. International news outlets are all over the story. India has almost 400 24-hour television news channels, thousands of newspapers, but too many of those outlets have grown dependent on government advertising money for their survival. And they're saving their tough questions for political leaders not named Modi.
Why is there a concerted attempt being made by those in the opposition to try and undermine confidence in public health today?
A very, very large section of the television media in India is very, very servile. What we are seeing is only a change at the margin. When we see on the social media stories of human beings whose lives have been completely destroyed because of the non-availability of hospital beds, of oxygen facilities, of vaccines, even for those journalists who've been acting as advertising agents of the ruling government, it's become difficult to not reveal the truth.
What big national broadcasters generally do is they can't not report crematoriums overflowing in, say, a Gujarat or in a Chhattisgarh. But the criticism is largely directed towards the local state government rather than the central government.
Is the Madhya Pradesh government actually concealing data of COVID deaths?
Because it is the state government that is supposed to handle the healthcare network. But where the large media houses have failed is in questioning the central government on the issue of why vaccines are not being made available to the public.
Most countries suffering from vaccine shortages lack the means to produce them, not India. It manufactures more doses than anywhere else, but has been exporting them to a total of 92 countries. Politicians have boasted about that, calling India the world's pharmacy. In January, Narendra Modi's health minister declared the pandemic was approaching its end. The Elections Commission then gave the go-ahead for elections in 5 states, with a combined 180 million voters. Super spreader events in the form of political rallies have since been held, attracting huge crowds, mostly maskless and unvaccinated.
So the Prime Minister's party and the incumbent party in West Bengal have been holding massive rallies.
आज चारों तरफ मैंने ऐसी सभा पहली बार देखी है.
There have been no COVID-related safety protocols followed at these rallies, and there are horror stories emerging gradually out of Bengal. The Prime Minister was shamed by the opposition Congress party into suspending his future rallies.
The Home Minister, Mr. Amit Shah, has been saying there is no apparent connection with the disease and the fact that there have been political campaigning and large crowds. At the end of the day, the attempts made by the saner voices that these large gatherings are really fraught with danger seems to be sinking into the minds and the brains of the leadership.
It was too little, too late. But what Indians witnessed this month during the Hindu Kumbh Mela festival was even more alarming. Throngs of Hindus, the vast majority of them without masks, descending on the Ganges River day after day. Initially, not much was made of that in the media. And although that did eventually change, contrast the coverage with what we saw in March of last year, when a Muslim movement, the Tablighi Jamaat, brought a few hundred worshippers together in New Delhi, and elements within the Indian media absolutely vilified them.
मानो बम जैसे कोरोना वायरस लेकर घूमने वाले को कोरोना जिहाद नहीं तो क्या कहा जाए.
It's a double standard, a revealing one, on Islamophobia on the Indian airwaves.
कुंभ बहुत बड़ा स्प्रेडर साबित हुआ है, कुंभ मेला, लेकिन वहां पर भी
The Kumbh Mela proved to be a super spreader event, and even then, the media didn't raise the kind of questions that it did when the Tablighi Jamaat's gathering took place in Delhi last year. It shows that the communalization of media, particularly Hindi media, has been extensive. There is a trend of hate-driven coverage.
जिसको कहते हैं ना, मैं उसको hate-driven होता है ना एक.
Today we're seeing a sea of human beings going into the river, and we've already seen 5,000 positive cases, and we have no idea how many more are going to test positive, and it's a nightmare situation, and it's disgusting, honestly, that the mainstream media, the big broadcasters, have not been more vocal about this.
There is no masking the media's reluctance to go there, their unwillingness to criticize Prime Minister Modi for the mess India is now in. It's not just that many of them share the ruling party's Hindu nationalist politics. No media outlet wants to risk losing all those government ad revenues. Just look at these front pages from this past Thursday, celebrating, of all things, improvements to the country's infrastructure at a time when the healthcare sector is in critical condition. Like so much of India's journalism, bought and paid for by the hand that feeds.